My name is Benda Kithaka. I'm with Women for Cancer Early Detection and Treatment. I'm a co-founder and the chair of the board. I like to talk about myths and misconceptions. Like there is the myth, for example, that cancer is a death sentence. By the fact that we have all these women survivors who are going beyond the disease through this program is proof enough that there is life beyond cancer. Then there is the other one that, cancer is contagious. And I find that to be quite a fallacy, because if you think about it, the people with cancer, unless somebody tells you I'm a survivor, you'll never ever be able to know. And what they need is more of hugs and love as opposed to shrugs and stigma. We need to demystify that. We also need to demystify the other one, that cancer is brought on by witchcraft or that it's a curse. It's actually probably drawn from the fact that some cancers may run in the family and the risk factors may be such that it's predisposed to genetic factors, like breast cancer, for example. But it's not sort of like a curse that has been brought on the family or that somebody is giving them the bad eye. People need to talk about these things. The misconception that cancer is expensive to treat, people need to know that it's about what stage it is caught. If cancer is caught early, in the early stages, the cost of treatment is very minimal. Sometimes even, they do not have to lose a body organ because it was caught early, and the recovery is 100%. Cancer needs to be a conversation that's had everywhere, in the churches, in the schools, in corporate settings, in government and in policy. We need to talk about it and demystify cancer so that people stop fearing it. It's one thing to tell somebody you have cancer. It's another to give them access to treatment early so that then they can become treated fully, recover 100%, go on to live normal lives. That way, people see the empowerment element. I can beat this. We need to stop treating cancer patients as if they are a different person. We need to emphasize that there is life beyond cancer. There is life after the diagnosis. There is life after the treatment, and not start treating them like a ticking sort of bomb, somebody who is waiting to die. The Merck More Than a Patient campaign has been very beneficial to our women because the women we have are cancer survivors, and often society looks at them as dependents. But with the Merck campaign, we're able to get these women empowered financially. They become self-reliant. They become contributors to the community. When these ladies are supported to be able to become income-generating members of the society, there is an element of self-esteem that comes with it. That someone is no longer dependent on others for their livelihood, or they're able to supplement what their spouse can be able to bring to their family. I think that's an empowerment strategy that's very, very good for the women, because as you know, they take care of the family. Can you imagine how much a woman impacts on society? A woman becomes the stability for the spiritual, financial, as well as social upbringing of children. When you empower a woman, you've empowered a community. When we get them back integrated into society as women who are contributing, both financially as well as materially, to the community, to the society, to their families, we are bringing out the esteem that the children will grow with. Our children need to see the positive. They're not waiting for mom to die. Let's not create a dependency. Let's get them to be financially stable and to be able to move on with life so that cancer becomes just one of the markers of where they've been in life. But it's a marker that has a positive story going forward, because we're creating real life experiences and we're creating real life success stories. What I see happening is that women know there is life beyond cancer. And that's very important to us, that women see hope today for a better tomorrow. That's what we live for.